So for those in attendance, just a reminder, if you could set your chat to all panelists and attendees. If the two of you want to do that also, you may. And let us know where you're coming from and how you, if you're an athlete or support athletes in some manner, coach, health practitioner, athlete yourself, and let's see who's out there. And then if you have any questions, we'll do an audience Q&A at the end. Any questions for Claudia or Dr. Duma? Would you prefer Alex for the audience or Dr. Duma?
You can do it, Dr. Alex.
Dr. Alex, okay.
Mixing both.
Reminder that there is a Q&A button at the bottom of your screen. And Royce is back from Wisconsin. Bill back from Maryland. Charlotte, welcome back. So my name is Tom Church. I am a massage therapist, a performance therapist, and a running coach based out of the Boston area. And this is day 8 of the Athlete Performance Mastery Summit. And today we are welcoming, excuse me, chiropractor, Dr. Alex, and musculotherapist, Claudia Chapel. And so let's do a little intro of the two. Dr. Alex is a doctor of chiropractic who holds a degree from the University of Bridgeport Chiropractic College. He is licensed by the state of New York and is a board certified diplomate of the American Chiropractic Board of Sports Physicians. Dr. Alex has spent many hours providing chiropractic care and sports medicine coverage to an abundance of professional and amateur sports teams, and continues to collaborate with various national teams, including USA Fencing, USA Archery, and USA Track and Field. In addition to spinal care, Dr. Alex uses various techniques like chiropractic adjustments, myofascial release, fascial manipulation, trigger point therapy, Graston, kinesiotaping, and rehabilitation exercises to treat a variety of conditions. Claudia, known to most people as Sparky, and I'd say my mentor, is an athlete and former dancer who has been a musculotherapist in private practice for over 25 years. Drawing upon a lifetime in competitive athletics and theater, she combines musculotherapy, strength and conditioning, motivational coaching, and nutrition to help her clients tap into their inner champion. Claudia has had the opportunity to work as a therapist to the New York Power professional women's soccer team, the United States Olympic men's and women's volleyball teams, and has been the coordinating therapist for the National Scholastic Athletics Foundation since 1994. Her commitment to success has earned her multiple trips to the Olympic Games as the therapist to the United States Olympic rowing team, the US Olympic track and field team, and the US Paralympic cycling team, as well as the trust and respect of some of the world's leading athletes and performing artists. Excuse me. So you can choose who goes first here, but what were your roads to your present careers?
I'd love to let Claudia start.
Oh, thank you. That's right. Respecting your
Yes,
elders. I
yes.
love that about you. Well, I was a dancer in New York and for many, many years, and I was always getting injured. And at about age 35, 36, it was getting more difficult to get out of bed in the morning. I was so stiff and I was hurting everywhere. So I called my muscular therapist, Dr. Ben Benjamin, and I asked him if I could get in. I said, what the heck's going on? I can't get out of bed in the morning. And he said, well, you'll have to come up to see me at the school. I had no idea he had a school. And I just used him as a therapist. Well, I went up to Boston to the Muscular Therapy Institute, and I walked in the door and I said, this is what I should be doing with the rest of my life. This is my transition point, because I was always giving massage and helping different dancers with, ideas of how to get better, how to keep from using things that I was using. So I already had this natural inclination to try and help people to heal. And so I went to school at the Muscular Therapy Institute. I actually am in practice now for 30 years. And my very first opportunity to do an externship was at the University of New Hampshire, where the medical director of the student medical center had just retired from the military academy at West Point, and he was so gung-ho about having massage as a part of the protocol offered to the students at University of New Hampshire, and people were just dumbfounded by this because nobody treated massage that way. Massage, ooh, masseuse, ugh. And so his reasoning was because his father had been a medical doctor and had written a book on massage in 1913, the course that he taught at Harvard Medical School. And he understood, this man who was also retired, and this is 1991, he understood the value of massage in the healing process and how necessary it was, especially under anxiety of illness, to have massage or have hands-on therapy in an appropriate manner. So from that point forward, by 1992, already I was still in school, just finishing up. I was I was working with the U.S. with the rowing team, and two of the kids from the rowing team made the United States Olympic team. And the team was training in Boston, and they asked me if I could work with them. And the next thing I know, I'm going to Barcelona. So we were not sanctioned to go there. I worked outside the venue, but my first Olympic team was in 1992, thanks to that one person seeing that what the work is valuable, and that the only country not using it well was the United States. So that's how that's my road, and my road went really quickly into the profession. So there you go.
Yeah, that's awesome. I had the exact same reaction when I walked into the school.
Yeah, amazing place.
Yeah.
Yeah.
That's awesome, Claudia.
Mm-hmm.
How about you, Dr. Alex?
So very similar to Claudia's background, an athlete myself. I started swimming at the age of 7 in Romania, where I'm originally from. And I was fortunate enough to get a swimming scholarship to University of Bridgeport in Connecticut. This is at the age of 19. At this time, I already had 12 years of quite strenuous, intense swimming background and the series of injuries, like every athlete. Tried quite a few therapies, and it so happened in my freshman year, as I arrived at the University of Bridgeport, somebody suggested, why don't you go and get treated in the chiropractic clinic? So in a way, I don't know, fate or however you want to call it, this university where I get a swimming scholarship, it so happens to have a chiropractic, acupuncture, naturopathic college. So I said, I have no idea what chiropractic is. We don't have it in Eastern Europe at the time. There wasn't much about it. I said, sure, I'll give it a try. And I had such an amazing experience, and not just with chiropractic, but with alternative healthcare, right? Chiropractic, acupuncture, naturopathic medicine, just looking at an injury or at a problem in a different way than just medication and surgery. So for me, this was just such an amazing experience as an athlete. I actually competed my best. I had my fastest times in my senior year, even with a torn labrum injury into my right shoulder. But all these modalities just kept me going. And again, I had such an amazing experience that I said, this is what I would want to do. I want to help others, help other athletes the same way as I was helped. And so after my undergrad, I applied into the chiropractic school. I went through that program for another 4 years. Then I continued my education with more specialized in sports injuries. That's why that diplomate that Tom, you were reading about, it's another 2 years that not all chiropractors do. It's actually about under 500 people, 500 chiropractors that get this extra training. And I was fortunate enough to start working with athletes, a lot of sideline work, fortunate enough to start traveling. So it's just interesting how I remember myself as an athlete saying, oh my God, I want to at some point be able to continue to travel and be next to athletes and be of help, and careful what you wish for, because 10 plus years later, I'm able to do that. So that's in a nutshell my experience with how I got into this field. And I think it's so similar for a lot of us, right? Both of you, always moving, always being active, and we have our series of injuries, and then this whole door opens up and you're like, oh, this is what I want to do.
Yeah,
So.
very true. So both of you have given examples that massage chiropractic is more than maybe the general public thinks about it. So they can be downplayed as being kind of single focused, especially, like I said, especially among those that don't know. But you do so much more to help athletes with skills beyond adjustments for chiropractors or relaxation for massage therapists. Tell us about how each of you and your colleagues have become more like jack of all trades. Is that a positive, being more of a generalist?
For me, definitely. I mean, what I've done over the years, I started studying very early on with different pioneers in the field. And so part of my research, even in the early 90s, was working in the fascia field, which is now like everybody talks about fascia and Graston and kinesiotape and so on. But I took all of Kenzo's earliest offerings in terms of how to kinesiotape. Or I studied with Tom Myers, who really opened the doors for anatomy trains that a lot of coaches now have in their bookshelves. And what I learned so early on is that every injury, every person is different. Every person experiences pain and or injury differently, regardless. I mean, you have to take in the emotional factors. And so when I approach my work, it's always with, what can I learn from this? How can I go home, not tell them everything, go home, think it through, and get back with them? There's nothing general about the work. You really do have to have such an arsenal, if you will, of modalities at your fingertips. Who can you call? Who can you touch base with? Massage is so basic and so natural. Hippocrates, the father of medicine, was a massage therapist. He never cut open a body. He had to intuit everything with his hands because he couldn't cut bodies open. The body was sacred. They didn't know what was inside. It was a God issue for them. So, having to think about touching people in a way that is okay for both of us. There's so much that goes into a single massage. You don't, in my work anyway. I'm an injury specialist, so are you, Tom. This is what we trained in. Mm-hmm. We're thinking about the body in a very different way. Mm-hmm.
Yeah.
So.
Yeah, so true.
Yeah. Mm-hmm.
Agreed. So similar to exactly what Claudia says, she's so right? Everybody's so different, every injury is so different. But to answer your question, I think chiropractic profession has been for years not getting maybe the best reputation. And my experience as an athlete was extremely positive. And when I started getting into this chiropractic school and finding out more about the philosophy and the past, it was definitely a bit surprising in not the best way. And I think there's still a lot of the old fashioned mentality of, oh, chiropractors just crack you, they'll hurt you, they want you to keep coming for life. And that has changed so much, especially with the newer generation. I graduated in 2012, have been in practice for 8 years. And first of all, I'm a doctor. My title says Doctor of Chiropractic. My responsibility, my role is to make sure that who comes through the door, I'm able to properly diagnose and make sure, is this a musculoskeletal, muscle, joint, fascia injury, or this is a problem where I need to refer somebody. If somebody comes in and say with the shoulder pain, right shoulder, and I can't reproduce, there's no cause of injury, I need to start thinking, oh, is this something organic? Is this a gallbladder issue? And again, refer out. So that's one, my role, being able to diagnose. And People's mentality has been changing. It has been changing, I feel, a lot with athletes demanding our services. Like Claudia is saying, athletes are
Mhm.
demanding massage therapy. They're demanding a chiropractor to travel with them
Mhm.
because they understand the hands-on value. You know, as important and as amazing a medical doctor is, when athletes are on the road and something does happen that it's not life-threatening, a pill or that won't solve it. They need that hands-on, quick, what can you do for me, what can you help me with, and talking more about jack of all trades, doing this residency where I have to learn emergency procedures, learn taping, just make sure I can do anything to help that athlete in that moment when they need to go back and compete. So it's been very positive and very helpful. um, Again, perception, public perception is changing, and I've seen it in practice. Even in the past years, people are like, oh, I've been to a chiropractor, I've had a great experience. You still have the older generation of both medical doctors and both public that they're like, I would never go to a chiropractor. And I really think that's a mistake in a way. You make sure you do your homework. Of course, like in any profession, there's bad and there's good. Make sure you explore that possibility, you know, especially with cases where people are like, I'm in pain and I can't figure out what's going on. Just give it a try. Make sure you get a good recommendation and give it a try.
I want to piggyback on that because two things happened very early in my career that showed me and showed the physicians around me just how valuable and how important our work is, and that the perceptions are changing, and that the athletes were demanding help. I had an athlete sent to me in the medical unit at University of New Hampshire. This was my first case, and it was 1991, I think, late 91. And this poor athlete had terrible spasms. They sent the fellow to me because they didn't want to hear about it anymore. You know, you got your spasms. I took one look at this boy and I knew he was deathly ill. And I went to the doctor and I said, you need to get him. I said, I do not have the credentials to diagnose anything, but I can tell just putting my hands on him, he is very, very sick. And it turned out he had stage 4 colon cancer.
Oh,
And I knew just putting my hands on him because this quality of his skin, the flush in his face, the distension in his abdomen, all these things were things I was trained to recognize that would be contraindicative for my work. I knew immediately, and the doctors were so mortified because they had sent him to, and I wasn't about to make them wrong, or I didn't want to cause any trouble or have an enemy. But they came to me later and said, this is what happens when you're turning people over all the time. You forget those little signs, those signs that are so clear because you're not looking up from your paperwork. So that was the first one. And the second one was at the World Championships for rowing in 1994, surrounded by all the other teams. And Germany was the nemesis of the United States back then in terms of racing. And the German doctors were there, and they're all there. Their chiropractor, they had a full staff. We had no chiropractor and one massage therapist for 125 athletes and 2 medical doctors, Harvard people. And, you know, I'm working on one of my athletes, and the doctor comes by and says, what are you going to do next? Rattle some bones over him for luck? And the German doctors heard this. They were furious. They say, don't say that so close to our tent. We're all here working together. She is as qualified to be here as you are. They stood up for me. So I'll never forget that, because other countries were already starting to make the shifts. And we have a lot of people, especially, it's changing now, but clinging to the shore of the old instead of like going with the flow, with the new. You know, this is the future of medicine. When we travel with the Olympic teams for Paralympics, they don't bring an MD. They bring a chiropractor and they bring 2 of us, soigneurs, massage therapists. So Just wanted to throw that in.
Oh,
I'm
thank you
very
for that.
anecdotal.
Now, anything that will just show just the skills and the talents that we do bring to our work.
Exactly.
And as
no,
Claudia.
yeah, and no, we don't bring bones.
No, but if you want them, I'll rattle something over you.
Yeah. So soft tissue work is such a great tool for both recovery and prevention when integrated at the right time. Could you tell us more about the timing of it when used both in the clinic and on the sidelines? And this is for both of you.
All right, so from my perspective, yeah, soft tissue work, sometimes, especially if you're a multi-event and or you have multiple races that you do it. I would use this for track and field more than any other thing because they've got to get back in there. They're going to do another race, especially in the younger athletes where they are expected to run multiple races for their teams. So soft tissue work in a what we call a sports massage manner, which would be quick, easy, light flush, maybe use some hydrotherapy like cold water effusion up and down the legs and in the arms to get the circulation more rapidly flowing. And if they need to be taped again, but in the hotter conditions, sometimes the tape doesn't stick, but it really works. Alex and I have worked a lot on that together. Dr. Alex Duma and I have worked a lot on taping people together. We do some very creative patterns to get to lift the fascia enough to get some flushing going so they can be ready for the next event. Yeah, so I use it judiciously. I would never use a foam rolling full-on massage at events because it's inappropriate. But in between, they're not competing for 2 days. You could get back in there, but definitely keeping it light and watching out for what's happening in the body if it needs a little more attention. How about you, Dr. Alex?
I 100% agree with you. Sometimes less is more, especially on the sideline or in between events, as you said, or when they have to compete the next day. And I'll usually save the more deeper, aggressive work like fascial manipulation or active release for when they're completely done with their event and they have maybe a week recovery or a few days until they start practicing again. So I think that's exactly as you're saying. Competition, less post-event, that's when you get in the deeper layers.
What kind of timing do you typically think about kind of before an athlete's competition, leading up to competition day or weekend?
I'd say it's so dependent on the athlete, and this is where, as Claudia was mentioning, traveling and being with different teams, you get to know your athletes, and communication is so important. If you're at a big stage event and you have an athlete that's been 10 years doing that sport, they'll tell you what they need, and you're there just to assist them a lot into their needs. So I'd say everybody's so different and everybody responds so different, and depending on also the sport that they're doing too. So that's my take on that. Claudia?
Yes, and I would also say this is something an athlete should look out for, because oftentimes you'll have somebody new on the team trip. I've traveled with same teams for many trips, but in the way that it works in the Olympic system is that they're always bringing new people in. So you may never have worked with this therapist before, or this chiropractor, or this MD before, and so you have to let the person know what you need. I mean, the athlete often has to take responsibility for that, because they won't be seeing their usual guy. It'll be somebody different, or their usual woman. So they need to be a little responsible as well. And the thing is, don't let anyone talk you into something that you're not going to be comfortable with. I know I will suggest to someone, I think this would be beneficial to you right now. I see you're having a little struggle with your shoulder and you're not getting it stretched out enough. Would you like me to do this, help you with this? And if they say, no, I'm cool, I'm fine, then that's fine. That's their choice. But don't let, I'm very, very cautious around this. Athletes know their bodies most of the time. The younger ones, not so much. They know what they know they need something. You can guide them, but I'd be careful about, I'm careful about imposing my will. And with marathoning, for example, I would say the last time someone should really get work is if the marathon's on Sunday, Friday night, and it should be easy. You know, somewhere during that week would be great for good flush and preparation, but not like Saturday. Saturday afternoon is a little late, and I've done it, but you've got to be really, and go really easy. And post-event, same thing. Maybe right afterwards works for some people. A good athlete, a seasoned athlete will know that I like to get my work done. You know, I come off the finish line, I like to get work done within an hour. They know. I mean, and Tom can attest to this, at which Boston Marathon was it? When Cosmos and Deddy, he came off the line, he puts the crown, the laurel wreath on my head. And he says to the guy, he says to the interviewers, I got the cameras all around him, he says, "No interview before massage."
Nice.
In Copley Plaza. So, you know, athletes know what they need, and you just have to guide them sometimes, but that's it.
Yeah, to piggyback on Claudia's answer, one of the questions I feel we both use is, to an athlete, what have you had done in the past that worked for you? And again, that opens that conversation, communication, and giving them that responsibility of like, oh, this is what I need, this what's worked. You don't want to try something new, especially at a high level athlete and events. That's not usually a good idea.
Right.
What about the athletes that are still trying to figure that out? Do you kind of have some guidelines for, let's say, post-event? Let's say after a marathon.
Yes, post-event. Well, now that's, and if it's their first marathon, they are going to be just exhausted and not really knowing what to do. So they'll, the new thought is you walk it off. You walk that. That's why at the New York City Marathon, they put the out, when they used to want you to go out up at, so you're at 62nd Street, they want you to walk that mile up to 82nd, 84th to go out of the park, because they want you to walk it off a little bit. But most people start to get too cold. So most marathons being held in the colder temperatures, they need to get warmed up quick, get their bodies covered up. And then if, you know, I would say get in the ice bath first, or, you know, get a shower and get the ice bath done, and then come and get therapy. You either get therapy later on in that day, but nowadays most people celebrate, so they don't do that, including seasoned athletes, although I'll have to say the Kenyans always get their therapy immediately. But maybe the next day would be the best. You know, like as marathons are usually run on Saturdays or Sundays, Monday would be perfect. That would be the best day. And it's got to be a light flush, nothing deep, not one bit of deep work after a marathon. All right, nothing. Your muscles have had as much work as they can possibly tolerate with those 26.2 miles. All right.
I agree with Claudia.
All right. We have talked a lot these past few days of the summit about how each athlete is different when it comes to recovery from injuries. And we got into this a little bit already here, how this can be a challenge for us. What has been your experience with the patient's response to what could be called a vague protocol for return to play?
Oh, well, I recently, last year, had that situation where an athlete had been given return to play, and he was a very, very high profile NBA player. And he was not ready to go back. And all the doctors were saying, "You're ready." And he was saying, "I am not ready." So a colleague of both of ours, of Alex and mine, and I worked with him, and he was the physical therapist, and he was adamant that that fellow be allowed to take all the time he needed, because there are two things going on in a recovery. It's the emotional recovery and the mental emotional recovery, and which is very real for all of us. And we can never downplay the psychosomatic aspect, because the psyche, the brain, and the soma are housed in the same building, right? They're not two separate entities. They are together, working together. And sometimes your brain is really trying to get your body to listen. Listen to me, I'm not ready. And your body's like, I gotta go. If I don't play this game, I won't get that scholarship. And that's not true. It's not true. If you're really a great athlete, they will still find you. So vague return to play is determined by you, by the person, and they have to be strong enough to say, I'm not ready, and continue their recovery. Is that answering your question, I hope?
Yes.
What I would add to that, as
Mhm.
Claudia is saying, everybody's different. Even though we, let's say, have a guideline for a protocol of an ankle sprain, and this is how it should go. Again, everybody is different. The best approach that I found as a practitioner is a multidisciplinary approach. When you can get for that athlete, let's say now the orthopedic doctor has evaluated, there's a nutritionist that gets into there, there's a psychologist that gets, a sports psychologist, as Claudia is mentioning, so important. If that athlete is fearful of going back and fearful of pain or fearful of injury, that is a huge impediment in that healing. So if you can get everybody to collaborate, and this is why I love working with you guys at this event, and it's so amazing to be able to street and then send it to Dr. Margaret, and she will do her part in psychology. But again, having that multidisciplinary approach, having the communication. And what I also find helping with healing is when you, as a practitioner, you are invested and you care, you genuinely care, and you have a positive energy and attitude, that for sure speeds up that healing process, right? If you're confident in this athlete and say, this is what's going on in this moment, but I'm confident you'll get back, you'll get stronger, you'll just being encouraging, that automatically helps. Than having that like, oh, I don't know how you're going to get back. It's not a good approach. So
Not helpful. I agree with that 100%. 100%. Always stay positive on that front.
Yes. Last week, Dr. Jas Randhawa, he's the performance therapist at Altus, as many of you remember. And he was saying it's not written in stone, but his experience has been with talking to the athletes, and when they are injured, he'll ask them 1 or 2 days after the injury, and he'll ask them how long they think they'll be out. And the athletes are very accurate about that.
Yeah, that's
They
true.
really know themselves.
Also, what I've been finding very positive myself as an athlete, former athlete, and with athletes, is having them visualize their healing. And I think that's been very powerful. Again, when you're adding it all together.
Yeah, agreed.
All right. So Claudia, you've worked with both elite athletes and Broadway performers. How have you found them to be different and are similar in what you see for injuries?
Well, and actually Broadway performers are very disciplined, and the performers I work with the most are musicians from the Metropolitan Opera and opera singers. So opera singers are the most disciplined of any athlete I have ever worked with. They take their bodies so seriously, because any small variation can destroy their career, can destroy their performance. So they are very careful about what they eat, about how much sleep they get, how much rest their voice gets, how much work they give their diaphragm. So that's fascinating to me. And athletes also are very, very, well, the thing that I find the most similar of these two types of people, one's an artist and one's an athlete, and they are different, very different, is the discipline, the self-discipline that is required to perform, to meet the challenges of each part of your career as an athlete or a performer. They're very, very similar in their approach, and it's quite self-centered. It's quite, narcissistic is not the right word, because narcissism is thrown around too much, but they're very, very self-centered, and it's a requirement of success in that stratosphere that they're aiming for. I mean, there are so few people ever will make it to that pinnacle, especially in the performing arts. It's the same as sports. What is, I don't know what the percentage is, but it's less than 5%, blah, blah, blah. They have to have such utter determination and focus as to be able to meet their goals. Where they differ is in their discipline around food. Like dancers, theater people tend to not eat very much and not worry so much about their food. They're more thinking about how thin they should stay, and you know, their interest is more towards how they look, because that's so important for making it, as opposed to an athlete who has really got to get the right fuel in and pay attention to what they're putting in their bodies to make them compete better. And those are differences, but the similarities are the utter focus and determination to succeed. And that is what I love. That's why it's such an easy transition to work with both athletes. And I work with the NBA. I'm working with all kinds of athletes in New York City, but I also have these performers that are completely different. And right now, I mean, everyone is shattered about what's happening. That's a given. So they're dealing with a lot more complex issues. And it's like an athlete that gets hurt, a performer right now that is 18 or 20 years old, that's about to enter the arena. They may not be age appropriate for the roles they want when Broadway comes back. And think about that. And their careers, and the same with an athlete. They're at the beginning of their careers, and everything's stopped, and they have to keep training as though we're going to open tomorrow. And that's a huge burden, and they both face that, and it's the ones that can manage it. I mean, I could talk about I Am a Champion. It's the ones that can manage that aspect of uncertainty. They're the ones that will succeed. And that's what I noticed between both groups. That's their similarity, and their difference is what it requires, like eating and all these different things that athletes need, performers don't care so much about. Paying the rent is what they care about.
Yeah, yeah, great. Thank you. And we'll get into I Am a Champion in a moment.
Yeah. But yeah, later.
So back to both of you. Dr. Alex, having grown up in a European sport training model, and Claudia coming from a performance background as an athlete also, how have those experiences shaped how you work with your patients?
Sure. So growing up, as you said, in Eastern Europe, Romania, I think this brings a great value for me working with different athletes from different backgrounds. Just having that approach and being raised somewhere differently, I can relate to people that are from different backgrounds. But what Eastern Europe, I'm sure you probably both know, sometimes, especially the older model, tends to be harsher in terms of training, in terms of communication. I remember as an athlete myself, I wasn't necessarily told what was going to happen when I would have a medical visit or a certain procedure, right? There wasn't the best communication. It was more like, okay, lay down on the table, I'm gonna put this pads on, and nothing explained of why and the rationale behind it. So taking that experience, I now make sure I am very communicative. I think that's a pride with the skill of being very communicative, especially with younger athletes that are at the age where there's still a lot of maybe uncertainty or fear or shyness combination, and just making sure I explain very well of what I'm going to do, get them engaged. You know, this muscle is here, this is what I do this procedure. So having that Eastern Europe, not much communication, it's more like yes, no approach, and turn it into being overly communicative in that sense of always engaging and saying like, this is what will happen, this is what you'll feel, is this okay, you know, give me some feedback. So I think it turned my background into a positive with how I practice with patients and especially younger athletes that I work with.
As an athlete, my athletic experience, the person that trained me to win was a Romanian coach.
I remember you were telling me that.
Yes, Radu. And our workouts were so brutal. I mean, we had barf buckets all around the gym. And then, you know, running, we would run stairs with paint cans in our hands. And I'm, you know, 5'2". I weighed, you know, 105 or 6 pounds, and I'm running with these paint cans up the stairs. But anyway, it was worth it because I won a world championship that year in my sport, which is an ocean
Okay.
sport. Okay, but what I learned from all of that, and also again, non-communicative, you just do it, do it, do it. And I did it because it's so intimidated that I was an older athlete for this championship, and everybody on my team was much, much younger. I realized that I communicate a lot with my athletes as well, because I didn't like so much just being shoved, pushed. It worked for me in the end because I got so, and he would say, "I have created the monster." He would say, but I'm sorry, I'm anecdotal. I'm very anecdotal. So one of the things that it helped me with is realizing just how much you have to share with that other person, with your athlete, to get them up and moving and giving them all the tools they need. And that's definitely been a part of what I do when I'm working with somebody. I don't just shove them into it. I help them, you know. Yeah.
Yeah. Thank you. Dr. Alex, I've had many clients ask me about what Graston is. They hear it is good for injuries, but they aren't sure how so. Could you tell us what it is and what the theory behind it is, and then go into kinesiotaping also?
Sure. So both techniques are meant to facilitate the body's natural healing process. Actually, Graston is a technique that originated in China many years ago. Comes from scraping, where actually either a metal spoon or a coin was used to bring more blood flow to the area and help with healing. And Graston started in the 80s. It really gained a lot of popularity with helping injuries, helping scar tissue. That's what it's used for a lot, increasing blood flow to the area. I see amazing results post an injury, say an ankle sprain, the body's natural response is to create almost a cast around it and create scar tissue. And when it heals into a way where it's not perfectly aligned. That's one way of explaining where these fibers are this way. So it heals almost haphazardly. And Graston helps with breaking that scar tissue, creating a good type inflammation, increasing blood flow. But yeah, it's a great tool. It gives a lot of feedback when you're using. There's this metal tools, and you can feel a lot how the tissue in the skin feels. And I love it for injuries, post-surgical, increasing range of movement. Had people coming in and they're saying, I'm unable to take my hand and put it behind my back. And once you start working with the Graston, very safe, and it should never be painful, maybe a bit uncomfortable. But yeah, wonderful technique that's really gaining a lot of popularity, and it's been used by physical therapists, chiropractors. And the same with kinesiotaping. Kinesiotaping is a type of stretchy, elastic tape, not as rigid as athletic tape. And I'd say with the athletic ankle type tape, you don't have much mobility. Kinesiotape will still allow you to do all the activities pretty much, play all the sports that you want to, but stabilize the joint, the muscles, the fascia. Helps actually with acute injuries. I've seen it again work amazingly with something that swells up like an ankle. You automatically do a lymphatic drainage, and it will help move that swelling and speed up the recovery process. And also with acute pain, it helps with tricking just a bit the brain by dimming down the pain signals. We call those nociceptors. So when that tape is applied after something very acute, the brain doesn't perceive it as painful. So a lot of benefits with it. I really like it. Even for pregnant women too, I've been using it. That's been great to give that support in there. So yeah, a lot of benefits with those techniques. They're great to use.
Yes, I used it for pregnancy. For my daughter when she was pregnant. I
Nice.
kinesiotaped her.
Nice.
Yep.
Thank you. We're starting to see things like kinesiotape on the store shelves, and I think even people trying to figure out how to do Graston type of techniques on their own. Is this something you'd recommend, or you really stick to working with someone that really knows what they're doing?
I always say leave it to the professionals, but I mean, that's my first, but you can, I mean, people have been using spoons and for millennia, to when they've got some pain. I mean, that's a very ancient technique, the scraping. The kinesio tape, everyone's watching YouTube's
YouTube.
how to do it. You don't do it so well, but it's not going to hurt you. But if you really want to have K-tape done properly, you go to someone that knows it, really knows it, and has worked in fascia release. And actually, the original idea and what we've seen under an electron microscope is that when you just lay the kinesio tape down, it lifts the skin just enough to allow for cooling at the very surface. So the cooling process begins the healing. So that the as you said, the nociceptors, there's a different kind of information going to the brain now, and so it's even the lightest kinesio taping it has effect. But I would definitely say leave it to the pros if you really want to get a good taping job.
I agree with Claudia, or at least try to see somebody that knows what they're doing before, and then they can guide you when it's normal. You can be somewhere and now you have to be taped, and I've done it in the past. I'll show my patients, I'll explain, and then I'll give them some tape to take it at home. They always come back and say, I couldn't do it as good as you did. And I say, well, that's why I did go to school all these years. But I think our intention is to always empower the patients, the athlete, to be able to do a lot of the things on their own too. But it's always a good idea. Check with somebody, make sure that's the right thing for you before you start watching YouTube videos.
Yeah, agreed.
Yes, I do agree also. So Claudia, back to you. You have developed a system called I Am a Champion. I know this is a passion of yours. What led to its formation, and how has it grown and progressed since its formation?
Well, it ebbs and flows. When I started I Am a Champion, it was based on the fact that I've been working with the National Scholastic Athletic Foundation for so many years at that point. And I had observed these athletes, the young athletes that were successful, truly successful, spent the bulk of their time in the training room or the tent, the medical tent. They did not overly engage with other people. They always had all their stuff together. They were quiet, or even if we had to shut them up a few times, it's because they were exuberant. But I observed these behaviors of what young people look like as they approach their success. And there's something so distinctive about a champion, and it starts very early. And usually the first mark is their willingness to help others, their level of service. It's the mark of a champion is their willingness to serve. And it's called eudaimonia, serving with, or in Hawaiian, they say kokua. It's like when you do it without being asked. They're the leaders from the beginning. They could be freshmen in high school, but they're going to be the captains somehow. They already have that displayed. And I started to really see it all over these huge venues with 4,000 athletes. I could see those champions all around the track. And I said, I've got to do something with this. And so I started to work with more and more kids. I started offering some small internships in my office to come and give me a couple of days a week or an afternoon a week, go to the post office for me. And I'd have these conversations developing with high school students and athletes. And I have found that the ones that make it, and some of those kids I have seen in the NSAF and been on Olympic teams with. So I've seen their progression through the high school, through college, and onto the Olympic team, what kind of people they are. And often it's that very person, that captain, that's in each and every one of us. So one of the techniques I've used is when they're lying on the table and it's so noisy in there, it's so noisy in the training room, and they're lying on the table and they're trying to get ready for their race. I do a breathing technique with them, and I have them anchor. I use like a neuro-linguistic programming technique where they anchor onto the greatest race of their life. And it could have been in the 6th grade, you know, it could have been the time that they saw for the first time that they could do it. And I have them anchor onto that, and I have them breathe through it, and you feel their heart rate rise as they're coming to they're on the line, and you know, and then they calm down again, and they rise, you know, they just keep going. And then they get up off that table, and I say to yourself, I am a champion, in your head, over and over again. I am a champion. I am a champion. And by the time the therapy is done, they shout out, I am a champion, right on the table. So I, one year, the upstairs track at the Armory, somebody came downstairs, like it was Joy Kamani comes downstairs, and she said, they're all shouting, I am a champion upstairs. What have you done to those kids? So it works. It just is a technique to get you to really tap into who you are. And it starts with how you treat your little brother, how you prepare before you go to school. Do you have your cleats in your bag? Do you have an apple for after school? I mean, like, everything counts when you are preparing. Every single thing that you do. Did you do your homework? Is your bed made? All those things go into it. So that's what it is.
Thank you.
And it's still going strong, because I use it with kids in Europe. I use it with the teenagers in my neighborhood in France. I use it with everybody. You know, pull yourself out of your doldrums and tap in to who you really are. You're better than that. You're better than this. Yeah. This moment, right?
Yes, wonderful.
It works.
All right, so finishing up, back to both of you. Both of you have had the opportunity to travel with your work. What have these experiences been like? You've talked about it somewhat already, but let's get into some more.
They can be good and bad. Well, my experience as in medical, there's certain teams are better at handling how they work with medical than others. My best experience would be with Paralympics, because they actually, well, it's not my best experience overall, but it's my best experience in terms of like how medical is treated. We are as much a part of the team as anyone else. They make sure we've come a long way since my first, 1992, 96, I was at chief therapist at the venue. All the Olympics have been different, and our end, like in 96, there were 2 chiropractors for the entire Olympics for all teams allowed on the premises at the Olympic venues. If you can imagine, 2 chiropractors for the entire, that was
a lot
crazy.
of work for those chiropractors.
Yes, outrageous. But we've come a long way in a lot of areas. My experience with track and field, for example, in the old days where they didn't even have tickets for us, and they knew we were going to be traveling with their team from 6 months out. But when we didn't have, we would be and Dr. Mason may have mentioned this, but he and I traveled one time together with the team, and they didn't have us on the list. They didn't have tickets for us. We were the last 2 people on the plane. I mean, you're going to need us when we get there, but they didn't. So it depends. Some teams are really great and are very cohesive, and the staff has been together a long time. Most teams are not that way, because the Olympic Committee works where they give, it's almost like a reward for years of service, and you've gone and done your 2 weeks out at the Olympic venue, and then they send you out on some trips. The smaller teams tend to be better managed. I'm sure Alex could speak to that, but they're better managed in terms of like how there are just so many logistics to deal with. So traveling with your kids, getting your stuff there, being able to handle all the equipment, having your equipment arrive on time, like there are a lot of tricky points in every international trip and you want to protect the athletes at all costs. They can't have those problems. Only the staff should be dealing with any of that. The athletes should only be thinking about how it's going for them and not have any worries. And that's it's exciting because there are so many variables on every trip, but the athletes need to be free of all those variables. The variables are only for us, right? It's exciting.
Yeah,
What's it been like
I
for you?
I agree with what you were saying, Claudia, and I'm again very grateful. I've always been a big traveler. I love to travel,
Yeah.
and my profession now has been giving me this amazing opportunity of still being able to do what I love, to be of help, and then travel the world and see places that I don't think I would ever have the chance to see. I can name Uzbekistan. I don't know if a lot of people even know of that country or they would ever go to. And I was fortunate enough to travel for a world championship junior fencing event. And it was an amazing experience getting to see this different culture, experience different food, different architecture, to see just amazing, amazing. It was an amazing opportunity. So yeah, I can't wait to travel. I really miss it. My last trip was in Greece, in Athens, with the women fencing team. They had the World Cup, and I don't know when we'll be able to travel again. I hope soon, but definitely miss it. So
Yeah, I love that part. But one of our jokes always in my end of it is because I'll be the only therapist for 125 athletes. So people say, "Oh, you were in Budapest?" I say, "I think so."
yes,
You
that's
were
true.
in
You don't.
you were in Poland? Probably. I never get. I'm in the, and I'm always in some bunker somewhere because that's where they put the medical. You're in a bunker, a former bunker when you're in the Eastern Bloc, and you're in. You don't see anything. The kids will come back and say, "Oh, the food is delicious. We went here, we went there," and you're like, "Oh, great."
Yeah, that is
Bring
true.
me back. Oh, it's so funny. But I see it from the bus from the airport into the venue. That's what I get to see of any country I usually go to. That's how it works because usually I'm the only person. So I miss that anyhow because it's really fun, and the athletes always come back and tell you all that they've been up to, and that's a vicarious pleasure as well. And I don't mind. I didn't, as I always say, the athletes. I didn't come here. I didn't come here to make you peanut butter and jelly sandwiches. Which is what we have to do as a soigneur sometime when you're with the cycling team. You make a lot of sandwiches as well as do the therapy and the taping and everything else, ice baths. But I didn't come here to make the peanut butter and jelly sandwiches. I'm glad I could do that for you. And I hope you're having a great time because it's a beautiful place. I hope you get out to see things. I try to encourage them to go, but I know why I'm there. So
I've discovered the trick when traveling. I'll wake up very early and go for what I call
yes,
exploratory run. So I'll be able to see some of it. I'll be up at 5, and then you can start with the team 7 till 10 sometimes, as you say.
yeah.
Don't see anything else than the venue and the hotel room.
We did that together one time, you and I, for World Track Championships. Didn't we go out and run around Staten Island?
Yes, exactly. Yeah, that's good.
It's pretty funny. Yeah, for nationals, yeah.
Yeah, I've had the same experience with even 20, 30 athletes. So
yeah.
But it's a wonderful experience no matter, whether you're spending 24 hours a day with them and not doing anything else or whatever it is. So
it is the energy.
Got some Q&A.
Let's find out what what our audience is asking. So I'll just go down the line here. So Claudia, how long were you with the U.S. women's rowing team?
I was with them, men's and women's, 92 through 98. Yeah.
Lacey, do you remember Christine Schaffer?
I do.
There you go, Christine.
Does she remember me?
I believe she does. For Dr. Alex, how is sports chiropractic different from physical therapy?
Sure. So there's a lot of overlap, definitely. I've had a lot of classes where both sports chiropractors and physical therapists are in. I'd say that as chiropractors, having the doctorate degree, we get a bit more training when it comes to diagnosing not just musculoskeletal complaints. And also we do spend a bit more training when it comes to manipulation of joints. So not as much mobilization as physical therapists tend to do, more actual grade 5, what they call the cracking movement. But again, a lot of overlaps, and I've worked with a lot of physical therapists, and we speak the same language, we almost do the same treatment, so for sure some overlaps.
All right. And do you know how one would find a chiropractor with a sports specialty on the West Coast or anywhere?
Yeah, so there is, if you go online and Google Diplomate of American Chiropractic Board of Sports Physician, or DACBSP, that should pop out. And there is a list of all the chiropractors that have this certification, which does put them at a higher training than the regular chiropractor and a better understanding of sports injuries. So if you go over there, you should find in your area, you should be able to do by like 5-mile radius, 10-mile radius with the zip code that you're in.
Yeah.
I hope that's helpful.
Great. Yeah, thanks. Why don't you, if you could type that into the chat.
Sure. Yes. Let me do that. I'll actually try to link the website right away.
All right.
Don't ask me to do any of those things, please. I beg of you. No.
I think you're okay. Let me see if we make sense of this one. For competition prep, say a day before, what type of self-massage efforts for hips, glutes, and legs would you both recommend to help with recovery, and then to help with recovery 24 hours out? Foam rolling technique, still good?
Yes, but what I tell people with foam rolling is everyone's tendency is to go deep, get that roller in there, but that is not what the body needs. Foam rolling is a surface. It's like the communication. It tells the body what's going on deeper. So when you foam roll, go over it nice and easy, nice and light for prep and also for post, because you want the body to feel it, sure, and it helps to facilitate the stretching. I would use, to open up the hips especially, I would start with putting a pinky ball, and I mean pinky, not a lacrosse ball. You start with a soft pink rubber ball, like the high bounce. It could be a Rawlings, it could be a pinky. Pinky's the best, I think, because it's the size, that's great. And you put that in the center of your arch of your foot. And you take it from the arch of the foot right below the knuckle joints of each of your toes, and you roll it around, and you do it in a very concentrated circle around your foot. You can go from inside to out or outside to in, and you do it 2 times per foot approximately. And then you roll it through the center of the arch. And then you'll start that superficial back line of fascia to release. And then if you're warmed up, and if you've been warmed up when you're doing all this and you've warmed up, I would go into I would do pigeon pose. I would open up those hips and sit in that position for a minute. And really you want to feel it in the across your glutes, across your piriformis. You want to feel that nice, even stretch. It should not be painful. You should feel it, but it shouldn't hurt. And that's what I say to start with. After you've competed, after you've raced, foam rolling is good. You give it I would do the ice bath. I would then use the foam roller the next day. I wouldn't foam roll out necessarily. I wouldn't, but people do. It's up to how has it worked for you in the past? Think about that. Have you, I would roll the calves. I would really roll those calves over and over and over again, nice and light. Get those calves to respond, stretch them out. Is that helpful, I hope?
Yes, absolutely.
Okay.
Dr. Alex, do you have anything to add to that?
No, nothing to add. And sorry for being distracted a bit. I want to show you the reason why I'm distracted. 1 second.
Would you have a dog? Don't tell me. I knew it. Oh, first child.
Yes, everybody's happy to see a puppy. Puppy makes us happy. But this is his 4th day with us, so still very new and learning how to be a good Zoom attendant. He's been good so far, but this is Hudson.
Hudson.
Yes.
Hudson.
So
Carry on.
nothing to add. Thank you so much, Tom, for organizing this. I hope this was helpful for people, answered some good questions, and this was great. I can't wait to see you guys, hopefully at an event.
Oh,
Yes,
I'll miss you all.
you're welcome, and thank you. I think we could chat all day
Yes.
Yes.
about this stuff. So, and feel free to pop in tomorrow at 11. We're talking with Nancy Clark.
Nancy Clark tomorrow. Good.
Performance.
Thank you so much,
Great.
Tom.
Thank you so much.
You're welcome.
Have a good day, guys. Bye.
Aloha, everybody.
Bye-bye.
Okay, bye.
So yeah, once again, tomorrow we'll be talking with Nancy Clark, sports dietitian, and just about that. And then of course, some thank yous to NSAF and athletic.net to help make this happen. And a raffle is happening on Friday for everybody that's watching these videos, and including Altus and their 6-month and 12-month memberships to their digital video library. Earbuds, 2 pairs of earbuds from Jaybird and 4 pairs from JLab. A signed copy of Nancy Clark's Sports Nutrition Guidebook. 2 signed copies of The Trail Runner's Companion by Sarah Lavender Smith. 2 signed copies of The Anatomy of Sports Injuries by Brad Walker.
Nice.
And a sampler pack from Honey Stinger. We'll be doing that on Friday afternoon, after everyone's had a chance to catch up on all the videos. So we will see you tomorrow at 11.
Thank you, Tom.
All right, signing off.